is a necessary evil, and health care is a necessary evil that a lot of us can't even afford.
Sure. There are obviously several ways. Through the state of Florida, whether it's Department of Health or ACA, I mean, there are ways to report things like that, not knowing the individual case, but there are a couple things that I just would mention is that we all feel very strongly and believe in the free market. But when it comes to healthcare, there's very little free market at all. They are probably the most heavily regulated industry in the entire country. And because of that, there is a certain amount of astronomical costs or additional costs that are put on them because of the regulation, whether it's, you can't even open another building without going for a certificate of need. I mean, there's a lot of different things that factor into the underlying costs. But the state of Florida does have a program, like in your particular case, that you can actually report that. And we, on a regular basis, will actually come in and ask for audits of different organizations to actually try to get a handle on it. There is an area that I do think is going to have a very positive impact on healthcare, not just within the hospitals, but other clinics and doctors, and that's really moving into the next century when it comes to information technology and records and the ability to, when you go into the doctor, instead of you having a huge folder of all your records or your prescriptions or whatever it may be, and your doctor having that, but it's all completely online, coordinated care, which ultimately will also, I think, lower some of the costs. At Orlando Health, we have made a significant investment into that technology, and I think most of the other organizations have as well. But in your particular case, there is a process where you can go to somebody and say, look, I don't necessarily agree with that. Probably in the last 4 or 5 years, really disclosure has come out a lot more. Not as much as Solantic, where it's on the door, but you can ask and say, what specifically is this going to cost before as opposed to after?
Yeah, thank you. One more question.
A quick question for the panel, and it's kind of directed to Senator Gardner and the woman, I'm sorry your name, from Solantic.
Karen.
On what you said, the price is on the door. Now, there is a great disparity between, I had surgery years ago. It went to Blue Cross and Blue Shield. It was an $85,000 surgery, which was reduced down to about $42,000. Now, if I didn't have Blue Cross and Blue Shield insurance, I would have been responsible to that hospital, doctor, anesthesiologist for the $85,000. So why is there such a disparity, and are you looking at anything, is there any thoughts as to why can't we bridge that gap? Why is it someone who doesn't have insurance, which does create a financial burden, bankruptcy and such, why is it that they are burdened with the non-insurance rate? Is there, I would assume that you've done studies and you have statistics at Solantic that you know the differences in a network, in a non-network or non-insured scenario. You probably have the same pricing, but hospitals don't. They're allowed a dual fee schedule per se, even though it's not truly a dual fee schedule. Has that been addressed? Do you have any thoughts on that?
On the state level, I don't know if it has specifically or not. I know that, Medicaid, and there's a lot of discussion about some people saying, well, let's follow a model of Medicaid. The issue with Medicaid, again, as I mentioned earlier, is the reimbursement rate of whatever the government says this is all we're going to pay. So the government will, to some extent, cover or set sort of the tone of what potential payment will be or lack thereof, as I would see. But the other thing that happens with Medicare is not fully funded by the federal government. Medicaid may only be 55% fed, and the rest is paid by the taxpayers of the state of Florida. So when mandates come down, that ultimately will raise the cost across the board for private insurance and as well as Medicaid and Medicare. That potentially has an impact. But whether there's been a specific example or a study on the state level that specifically looked at to the example that you talked about, I'm not specifically aware of that. Obviously, a lot of it depends, I'm sure, on the market and what's driving the particular issue as well.
And I'll just add that there are some websites now with providers starting to post prices. So I think you'll see more and more of that. And I can tell you it wasn't easy for us in the very beginning because the way insurance works, the pricing is related to a code. So I look in your ear, it's a code, you know, I look in your chest, it's a code. And so it's very difficult to tell you what it's going to cost until the end of your visit, because I don't know what I'm going to do to you. And in fact, when we were working on the business plan, we called a number of different doctors and said, I want to have a physical, how much will it cost? Well, it depends on what you have. Well, what am I going to have? You know, okay, well, are you a man, are you a woman, what age are you? And the range was anywhere between $200 and $700. Well, that's a big range. And so what we tried to do was look at the codes that might be normal, and we separated our visits into a level 1, level 2, level 3, and then said, you know, to see a doctor, get a script, it's this, get a procedure, it fits into this bucket, and then the most you would ever pay, so there's a cap on it, you would know exactly what you're going to pay. And I would argue that that could be done in a number of other type services.
Yeah, I would venture to say at this point in time, with e-technology that's coming around, other carriers other than Blue Cross as well, Blue Cross and Blue Shield, we have tools out there where you can go out to the websites under your own account specific names and put in some of these codes and identify a range of cost. Pharmaceuticals the same way, you can do those types of things. There are more transparency aids out there so that you can take a look and be a smart shopper to take a look at these things. Actually, Blue Cross and Blue Shield partnered up with Humana a while ago on a program called Availity, and it's actually in the doctor's offices in the hospitals where they can actually look up the codes, kind of give you an idea what it is. As Karen said, though, there's a lot of times when you go into the doctor's office, you may need additional types of services. And so when you look at those things, you have to be aware that, you know, with the additional services, there's opportunity for increased charges because of the services you're getting.
And it's tough. This is the first year that we've seen more and more people on high deductible plans, which means they're personally responsible for really the day-to-day stuff until they meet that deductible. And so the price is more important to them than ever. They'll come in and haggle about the price. And so much so, and sometimes these systems, they're fabulous. If a patient comes in, you check their insurance and find out, well, what's the deductible, what's the copay? Well, because they're not real time, you don't always know. And so, unfortunately, Solantic, like a lot of other doctors' offices, now are having to collect up front, and it's really causing a problem with patients. They don't want to pay. They're not used to paying for health care.
Just real quick, an important website. Florida has a very high priority on transparency and consumer health information, and it's floridahealthfinder.gov. That's floridahealthfinder.gov, and really moving towards showing appropriate pricing. But there's a lot of other good information on that website. It can help with resources. It can help with printing up information to bring to a doctor's office for your employees so that they, you know, are empowered and they know what the right questions are, because people get intimidated. So there's signs and symptoms. There's a lot of good information on that website. So I would recommend looking at that and sharing that with your employees.
First of all, I want to thank y'all for being here. I really appreciate it. Also thank all of you for coming out. This is an important discussion, and what we see on the news are these, you know, shouting matches at town hall meetings, but it's more than that. We all need to be educated. It's important, and I think it's testimony to that's important that we have 150 people who came to this luncheon. So you care, you're involved. The Sentinel had an editorial today that lists websites and phone numbers that you can call to communicate with the people who represent you in Washington. You've got more information here. You know, we just really appreciate your coming out, your being involved, and being part of the discussion. Thank you so much.